Karen here. Hope you're having a great day. It's Friday today, and I'm going to be starting a pelvic health series. So to start, we're going to be talking about the pelvic floor. So what is the pelvic floor? What muscles? How do you activate them? And what are they used for? So as a pelvic health therapist, we work with patients that have issues with their pelvic floor. So this is a depiction of the pelvic floor muscles. So you've got muscles that work like a sling that run front to back in the pelvis. Okay, so you can see that they support the organs. So inside the pelvis, you have, for a female, you have the bladder, you have the vaginal opening and the uterus, and you have the rectum. So the pelvic floor really works to suspend and hold up these organs inside the pelvis. You have small differences in the female versus the male pelvic floor. So the female has 3 holes through the urethra, the vagina, and the rectum, and the male has the rectum and the urethra. So the muscles in the pelvic floor are fairly similar between the male and the female, but the male's pelvis is a little bit smaller and obviously has some different external anatomy. So you can see here, you have these 3 muscles. Collectively, they're called the levator ani muscles. They run from the front to the back. So one wraps around the vagina, one wraps around the rectum, and one wraps down around and attaches to the tailbone and then wraps back up to the pubic bone. You then have this muscle here that forms the floor of the pelvic floor. You have these hip rotators here on the outsides, and you have these muscles that form part of the hip rotators at the back. So the piriformis is one of those muscles that you may be familiar with. In the male pelvis, again, you have very similar structures, but you just have the puborectalis and the pubococcygeus versus the female pelvic floor has the pubovaginalis, which makes sense based on the anatomy. So why might you want to do a kegel? So a kegel, if you have weakness in the muscles, you may start to have the organs start to sink down inside the pelvis. You can feel heaviness, pressure, or pain. And that's a common symptom of weakness in the pelvic floor. It can also be a common symptom of tightness in the pelvic floor. So you might have vaginal, penile, or perineal pain if you have lots and lots of high tone muscles in that area. The muscles, again, are just like the muscles in your neck. So you might hold lots of tension in your neck based on the different activities that you choose to do or the positions that you take throughout the day. The same is true for the pelvic floor. So you can have a really tight pelvic floor if you hold a lot of tension into the pelvis. So some of our patients, we're not actually teaching Kegels. We're teaching them relaxation strategies, how to stretch and get more mobility through the pelvic floor and through the hips. If, however, you have incontinence, so you're peeing when you're coughing, laughing, sneezing, or you're having urgency, so you're unable to hold the muscles to prevent yourself from leaking if you have to urgently go to the bathroom, then you may be someone that would be appropriate for a Kegel. So what is a Kegel? A Kegel is contracting these muscles in the pelvic floor with the appropriate strength, timing, and endurance to do the activities that you want to do in your daily life. I'll now be going over how to do a Kegel. So it doesn't have to be done lying down, and a lot of times, functionally, that's not how we use our pelvic floor. So having a functional pelvic floor, it's really important to integrate that into doing things like lifting, picking things up, sport, kicking, pushing, Valsalva, so like a bearing down type maneuver, where you really want to make sure that you have the appropriate timing and strength to work properly. But your basic Kegel, you're going to lay down on the bed. You can put your hands on your hips. Often I'll have someone put one hand on the abdomen to feel for the core muscles, one hand on the glutes to make sure that they don't tense up. I'll get my patients to take a deep breath in. And as you take your deep breath in, you're going to relax the pelvic floor. So the pelvic floor is actually going to come down. And then as I breathe out, I'm going to gently tension my pelvic floor. So I'm going to feel just through the vaginal or rectal opening, it gently squeeze and lift up. If you're feeling like you're bearing down or your abs are tensing, then that's using muscles other than the pelvic floor. So you're compensating by using your major abdominal muscles or your glute muscles. So these muscles should stay relaxed, and so should the muscles through the abdomen. So we're going to do 5 kegels. So take a deep breath in. You can try and hold for a couple seconds at the top. Make sure you're not holding your breath or bearing down while you do that. And again, I'm going to breathe in as I relax my pelvic floor and breathe out as I gently lift. Lots of imagery people will use is picturing a blueberry inside the vagina. You're going to think about grabbing onto it, picking it up, but not squishing it, and lifting it up into the pelvis. Okay, so now you know how to do a basic Kegel. I would suggest, if you're having any of these issues, that you get a detailed assessment by a pelvic health physiotherapist. That's the only way to accurately assess the pelvic floor. And a lot of times patients come in and they've been doing Kegels for years, but they actually are doing them incorrectly when they see them in the clinic. So they're pushing down or squeezing or tensing through the abdominals. So don't forget, if you're having any of these issues, it's really important to get an appropriate assessment to make sure that you're getting the treatment that you need for you. You're not just doing Kegels because you think that that's the solution, and that your care is really patient-centered for your issues. Thanks so much. Bye.